Mr. Secretary, thank you for being here.
Thank you.
I, too, am going to ask you about coronavirus. As you know, my home state of Washington is really on the front lines of this outbreak.
Absolutely.
I am incredibly frustrated and very concerned that we're not seeing a sense of urgency from this administration to deal with this and to get ahead of this crisis. And I'm especially concerned and want to ask you about the impact of this outbreak on people who are experiencing homelessness or housing instability, both in my state and nationwide. And I wanted to ask you, what specific steps is HUD taking to respond to this outbreak to make sure that people who are experiencing homelessness or people who are at risk of losing their homes receive support during this coronavirus outbreak?
I don't know if you were here before, but I said we have made it clear to all of the PHAs and the people who are dealing with the population that they may repurpose some of the money from the Emergency Solutions grants.
Okay, let me ask you about that. I did hear you say that to Senator Leahy, and communication with the public housing authorities is really important. What I am told is they have received the guidance that we're all hearing about, wash your hands, those kinds of things, from CDC, obviously important. But have you sent out
Yes.
information to all of the PHAs that these emergency grants are available, and what exactly are you telling them?
I can't tell you what it says, but that's the general. It tells them that they're able to utilize that money, and that they're also able to repurpose some of the CBDG money for that same purpose.
And have you given them guidance on how to do that? Because we have not seen it.
That would
And I'm
always
at the epicenter of this.
that would come with it, but I can have our people send that to
Can
you.
you verify to me that that has been sent to them?
I've been told that it's been sent.
All right. Let me ask you, are you preparing for potential mass shelter needs in any of the states? I mean, plans are so important here. You don't want to be behind the curve on this, and it's coming at us fast. Do you have any plans in place should we need large unsheltered places for homeless populations?
Well, as I'm sure you probably know, in terms of that, it's going to be primarily a FEMA issue. And you probably also know that in terms of the immediate medical care, that's going to fall to the state health agencies. Are we going to help them? Absolutely.
I know you're a member of the task force, so I hope that you are bringing these needs up as a part of that task force, because we are seeing
That is a specific area that the task force is working on.
Okay. Will you commit to taking prompt action to delay some routine inspections and grant extensions for housing authorities who are currently responding to this outbreak?
Will I commit to?
There's a really limited staff time, and this is a rapidly evolving situation. On a daily basis, we're seeing the numbers grow, the populations that are impacted. So the routine reporting and inspections are taking a lower priority for some of our housing folks who are dealing with this critical emergency in front of them. Can you?
This is very high priority, very high priority.
Can you make sure that they will be given some relief to delay some of the routine inspections and grant extensions as they respond to this, so they are responding to what's in front of them?
Of course, as that's a really urgent situation, that goes right to the top.
Okay, and this is critical. Do you have any plans to provide housing authorities with additional cleaning supplies and personal protective equipment as they respond in our housing agencies?
Well, again, that would not be something that HUD would do, but we have asked them to be.
These are our facilities. These are our employees. These are our people in these sites, and they need to know that when they have an outbreak in one of our housing, that they've got personal protective equipment. This is the challenge that we are facing right now. Firefighters who are showing up at nursing homes and are then exposed to the virus and testing positive, obviously taking it home to their families as well. Having personal protective and equipment so they can respond to an outbreak in one of our housing units is absolutely important, and I would assume that's part of your purvey. Okay.
You don't have to convince me of that, but there is a mechanism for taking care of it.
What is that mechanism?
That mechanism is working through their local health departments, and we've instructed them on
Our health departments are
how.
on the ground doing everything they can. It seems to me that under HUD, we should be having plans at the federal level to deal with housing units, making sure that, that our folks who are on the ground there are taking care of themselves, so as they respond to this, they are not getting the virus or spreading it to their families, especially those who are vulnerable.
HUD does not have a mechanism for distributing all of that material all over the country. We
So we
simply
have a
it
problem.
doesn't exist.
That's how I hear it. Okay. Thank you.